Following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm Shay Paul, and I'm being joined by my friend, Dr. Jerry Chapman of Living Well. Dr. Chapman, it's great seeing you as always.
Good seeing you, Shay.
We're going to talk about one of the procedures that you do there at Living Well, and it's microneedling. But can you first of all tell us what is microneedling typically used for? What kind of skin condition would you have that would require that?
So microneedling is awesome for any skin rejuvenation.
Okay.
Out skin tone and texture. So patients who suffer from acne scarring, or sometimes acne outbreak, or even hyperpigmentation, large pores, so irregular contours of the skin. This device can be used to even all of those things out and make the skin look tighter and smoother. It's a simple procedure. The patient comes in, basically we cleanse their face with a good cleanser, and then we use this device that has a little tiny set of needles on the end of it that you can barely see.
Okay.
Goes at very high speeds. It almost sounds like an electric toothbrush being run across the skin. And we do this in a circular motion. The end point of the treatment is mild, very mild petechial pinkness or bleeding. So it does prick the skin enough that you may see a little bit of bleeding. But then what happens is the micropores that are create micro damage in the skin, and then the body comes in and stimulates the collagen and hyaluronic acid to be built up and released, and then that tightens the skin and smooths the irregularities of the skin texture out. The procedure takes about 10 to 15 minutes to perform on most faces. On a scale of 1 to 10, most people say it's about a 3. We usually use a really good growth serum in conjunction with this treatment. Once we're finished, we apply product, which then is allowed to penetrate deeper into the skin. It's a very safe procedure. There's usually little to no downtime, even though you're making that little bit of prickly bleeding on the skin. By the time the patient leaves, they're usually just a mild pink to almost like a mild sunburn appearance. We do recommend that you protect the skin from the sun because, of course, anytime you break the epidermis down, you're more susceptible to sunburn. So we do recommend our patients all leave with a coating of sunscreen, and then we recommend that they keep that on there for several days. We recommend about 4 to 5 of these over a 2 to 4 week period in between. The patients who have had this done see remarkable changes in their skin, and they absolutely love the treatment.
Okay. So bottom line is, because there is little downtime, I mean, this is something that someone could feasibly do maybe on a lunch hour and go back to work?
Correct. We've had plenty of people do that. Also, there's something else we can do with this procedure. We can actually, I'm sure the folks out there have heard of the vampire facial. It's a branded facial. We don't do the vampire facial here, but we do microneedling with PRP. And that PRP is basically platelet-rich plasma, and we draw the blood from the patient. We have a special centrifuge that we place the blood in. We separate the cells from the serum, and then that serum can actually be applied to the areas that we've microneedled, and it stimulates a much stronger effect from the treatment, and patients can really see a great result with that.
Wow, and you are doing that there. You are doing that procedure with the PRP. Okay, I didn't realize that.